Welcome and thank you for watching this post-operative care video for Advanced Dermatologic Surgery. First off, take a comfortable seat and take a nice deep breath. You have safely made it through your procedure, and right now, your body's natural healing process is officially beginning. Over the next few minutes, we're going to walk through exactly what you need to know, step by step. We want to ensure you have a smooth, comfortable, and incredibly safe recovery. Let's start with Phase 1, immediate post-op expectations. For the first 24 to 48 hours, things like mild bruising, a bit of swelling, and even some light bleeding are completely normal parts of the healing process. In fact, your bandage might become entirely saturated, or you might notice a little blood leaking. If that happens, don't panic. Simply apply firm, direct pressure right on the surgical site. You can use a piece of gauze, a clean paper towel, or a washcloth. Now, the key here is to hold that pressure for a full 30 minutes. It's really important that you don't lift the gauze to check on the bleeding during that half hour. Just keep steady, firm pressure. And if your bandage becomes totally saturated and just isn't absorbing anymore, go ahead and safely remove it before applying that pressure. Now, let's talk about your bandage timeline. For the first 24 hours, or up to 48 hours if your nurse specifically instructed you to do so due to bleeding during surgery, you're going to leave that initial large, bulky white bandage right where it is. Once that bulky bandage comes off, you're free to take a shower. Underneath, you'll find a clear, waterproof bandage with a little white pad. It is perfectly fine and honestly completely normal if this clear bandage falls off on its own within 1 to 2 days. But if it happens to still be clinging on by day 6, you can go ahead and gently remove it yourself. Moving on to Phase 2, daily wound care and stitches. This will be your daily healing routine starting the very moment that clear waterproof bandage falls off or is removed. First things first, always wash your hands thoroughly to protect your healing skin from any infection. Second, clean the incision gently using just mild soap and water. Third, apply a really generous amount of Vaseline over the site. Keeping that tissue moist is absolutely crucial for beautiful healing. And finally, cover the area with a fresh, clean bandage. Any standard bandage you happen to have at home works perfectly for this. Let's discuss the removal of your sutures. You likely already scheduled a removal appointment before leaving our office today. But if you live a bit further away, you absolutely have the option to have your primary care doctor or a local dermatologist comfortably remove them for you. If you have stitches and you feel entirely comfortable doing so, you can even remove them yourself at home. We just ask that you give our office a quick call so we can cancel your appointment. However, please note that if your incision was closed with staples, those strictly require a medical office visit for safe and proper removal. Next is Phase 3, activity and lifestyle restrictions. Your body really needs focused energy to heal effectively, which means giving yourself permission to truly rest. Because the surgical area is under a high level of tension right now, we need you to avoid heavy lifting, heavy cardio, bending, or any strenuous activities for at least 3 to 4 weeks. Heavy lifting can actually widen your scar later on or cause sudden bleeding early on. Also, please try not to sleep on the side of your body where the incision is located. Now, light walking is perfectly permitted and actually highly encouraged. And if your surgery site is on an arm or leg, try to keep that extremity elevated on a few extra pillows for the first 48 hours to help minimize swelling. Phase 4, medications and pain management. The great news here is that you can immediately resume all of your usual daily medications, both over-the-counter and prescription. For managing any post-operative pain or tenderness, this over-the-counter formula is highly effective. You can take 2 extra-strength Tylenol, which is acetaminophen, right alongside 1 to 2 ibuprofen, like Advil or Motrin. These can be safely and comfortably taken together every 6 hours, assuming, of course, you don't have a pre-existing medical condition that prevents you from taking them. This simple combination works beautifully to keep inflammation and discomfort at an absolute minimum. Additionally, if a nurse discussed an antibiotic with you today and called a prescription into your pharmacy, please make sure to take it exactly as directed on the bottle. It's always best to take your antibiotics with a little bit of food to help prevent an upset stomach. If for any reason you experience a side effect or an unexpected reaction, simply stop taking the next dose, take a breath, and contact our office for further instructions. There are exactly 5 specific warning signs that we want you to keep a close eye out for during your recovery period. Now, these 5 signs are quite rare, but they're important to know for your peace of mind. Number 1 is strong itching with bright redness, which usually just means you have a simple sensitivity to the bandage adhesive. Number 2 is a fever over 104 degrees Fahrenheit. Number 3 is pain that actively worsens after day 3 rather than slowly improving. Number 4 is bleeding that just doesn't stop after you've made several back-to-back attempts of applying that 30-minute firm pressure. And number 5 is the presence of hematoma symptoms. Please keep in mind, if signs of infection do appear, they typically show up between days 3 and 7 of your healing journey. To be completely clear on that fifth point, a hematoma is the primary complication associated with early bleeding. It presents as a rapidly expanding, firm or tense lump, a dark purple mass, or severe and increasing pain at the surgical site. Depending on where your surgery was, it might also cause sudden issues with vision, breathing, or swallowing. If you happen to notice these specific symptoms, please remain calm, but do call our office immediately so we can swiftly assist you. Finally, let's look at your long-term healing path. Day 0 is your surgery day. Days 3 through 7 are when you'll primarily monitor for signs of infection. Once you reach the 30-day mark, you can safely resume applying your favorite sunscreen, wearing makeup over the area, and using scar reduction products like Silogen to help your skin look its absolute best. Please contact our office if you have any questions or concerns at all during your recovery.